So we're sitting here today to learn a little bit more about family integrated care. In the past we've heard a little bit about family-centred care. How do the two compare, or how do they differ?
So family-centred care as practice still really in the NICU still really keeps the family outside looking into the care team.
Mm-hmm.
So although meetings are organised with the family, we think we're doing family-centred practices,
Mm-hmm.
the family are not really invited to become part of the care team in the same way that we have family integrated care. So I think it's really changing that paradigm where parents are invited to become truly part of the care team.
Okay. So really integrated is the defining word where they become a key, or the key part.
The key party.
How do you reconcile a parent's expectation, or a mother's perhaps in particular, and a father's, 9 months of pregnancy and then a baby that requires a stay in the NICU? Of course, the equipment that they're going to, or what they were expecting for their pregnancy and what they're getting in reality. How do you reconcile a parent's expectations to reality?
Yeah, no, that's so it's really, really tough when parents give birth, particularly to a premature or a sick baby, and they're brought into the NICU environment, which parents report is really like entering a spaceship, you know, with bells and whistles and alarms going off. And that, I think, is why parents, and remember, they also don't know this little person. They know this person in utero, but they really don't know this person that's now in front of them, and it can be really scary. So parents, unbeknownst to themselves, will often run away from that environment, and I think our environment did not invite them in either. So for family integrated care, we really have to provide parents with the knowledge so that they know that they're important, and the structure so that they feel that we've created space for them, not just beside the bedside, but actually in our care team, and a purpose. We have to give parents a purpose at the bedside so that they do not feel like they're just an observer, that they really can get in there and take care of, this is their baby. I remember approaching a mum who had just given birth to a baby at 27 weeks gestation, and I went to her bedside and I described what family integrated care, and I said I wanted her to come into the unit, take care of her baby, and she looked at me and she said, "You want me to be a mother?" And I looked at her and said, "But you are a mother." So for some reason, NICU seemed to create a barrier to that feeling of being a parent or a mother. So I think trying to break that down and see. Yeah.
Fascinating. Yeah. You spoke about doctor, nurse and patient ratios quite quickly in your talk. I would imagine before or contemplating care, healthcare professionals may see this as an added burden to their already burdened workload. Have you had much feedback on their thoughts after implementation? Are their jobs easier? Do they have more time for other tasks?
So it's really, really good question. So people, in fact, there were two scenarios. One, people were concerned that their workload would increase, and by report, what happens is that, in fact, the workload does increase initially, but as parents become more confident at providing care, then the workload decreases. So that's important, and I think that's the report, is that it changes. The other concern was that nurses were concerned that we were going to replace them with parents so that they would lose their job, and that's of course not true, because coaching a family is sometimes much more time consuming than doing the work yourself. I describe it as when I was trying to teach my brother to wash or to dry dishes, and how long it took me to teach him to do it versus doing it myself. So it's really, I think, really, we do need to appreciate that asking nurses to do this does take time and effort, and it does change their job. And one of the things that was brought up to me a few weeks ago was that a good NICU nurse in the past used to be a nurse who felt, the parents would go to the nurse on discharge and say, "Oh, you've taken such good care of my baby, I'd like to take you home with me." And what we're trying to do is change that paradigm to sort of say, good NICU nurse is when the parents go to the nurse and say, "You've been such a good teacher and a mentor for me. I'm really feeling confident taking my baby home." And that's a shift. So we're asking the nurses to shift both what they do and where they get the reward from.
I would imagine in not necessarily all traditional NICU care scenarios, but at discharge you're delivered a baby or that you know, obviously, but then you're required to take it home after another post-discharge. Is there much evidence or any such data on hospital rehospitalisation for a mum that has or a baby that was in phi care and a mother that's not? Are the mums that have learned these hospital practices more capable, confident to look after a baby post-discharge?
By report in the pilot study, when we interviewed the parents, they were much more confident and much more aware. It's very difficult to sort out the access to healthcare piece, because what you really want to sort out is appropriate access to healthcare. So, for example, in our pilot study group where we interviewed all the families a few weeks post-discharge, some of the families had actually sought help for their infant and recognised that their child was unwell, whereas the care providers hadn't. And also we've had some families who actually have also appropriately recognised the child as sick and, for example, stopped and even called for emergency services, whereas in fact it wasn't recognised by other care providers. Okay. So I think there's that real understanding who their baby is, and they're the best person.
They're learning who their baby is, and they're becoming attuned to what is normal and what is different.
Correct. Which is,
From the healthcare professional side, is there any hesitation or perception that their practices are being watched? For example, hand hygiene may be audited by a mum or reported by a mum?
Yeah, very. So absolutely. I think one of the things that has to happen, and that's part of that culture change, is sort of acceptance that yes, that's going to happen. That the parents will protect their infant, and if they will comment on hand hygiene practices if they're not being practiced properly, but that's a good thing. And I think that's where we're changing, recognizing that a difficult parent that term difficult parent is really a parent who's in difficulty and needs more knowledge, and that there should be no difficult parents, that we're creating them in a way in the NICU by trying to control them.
You spoke about weight gain, and then you spoke a little bit about feed compositions. But in the intervention group, there was no breastfeeding specific intervention as such. It was just an entry and an involvement.
Correct.
What do you put this down to? This increase in is it just access? Or?
So I think it really is. You have to have parents present in order to increase breastfeeding rates. So really inviting parents in will naturally increase breastfeeding rates. No intervention for breastfeeding will work if you cannot get parents in to see their baby. So I think that's it.
And so for any healthcare professional that's watching this video and thinks, this is interesting, what words of wisdom can you provide them for investigating further, discussing with their peers, maybe taking some initial first steps?
So the first thing is that this is really a culture change in NICU, and you want to leverage resources that you have at hand to make this happen. I would direct people to look at our familyintegratedcare.com website, because there are resources there that actually outline how you might start a program like this and how you would set up your committee and what would be the baby steps that you would make to make this happen. So I direct them to do that. I think also realizing that some of the things that your staff do may already be heading in this direction, and you want to leverage those to help you. So find people in your organization who actually are already doing this and want to lead an initiative like this. And my third thing is all of our hospitals administration, they all say they're doing family-centered care, and it's probably on their hospital website and logo. But when you really dig down, most hospitals are not truly doing family-centered care. So perhaps getting data so that you can actually, from your patients, so that you can actually show that parents and families are still feeling isolated and not wanted in your NICU may help you leverage with your hospital administration to move this forward.
More about the data collection.
Yeah.
Wonderful.
Exactly.
Well, that's everything, all the questions I have. Thank you so much for coming. Your presentation is inspiring. We look forward to watching the space grow and see a more global phi care models existing. Thank you so much.
Thank you.